Welcome to Series 2 of the Latte Lounge podcast. Join me, Katie Taylor, as we talk balancing hormones, busting myths, breaking taboos, boosting libidos, and bolstering confidence. Why not grab a coffee, take a seat, and join us in the Latte Lounge as we chat all things midlife, menopause, and beyond. With thanks to our friends at Clarins for making this podcast possible. In this episode, we're going to be finding out about all of the skincare concerns that so many of us women worry about during our 40s, 50s, and beyond. I'm going to be discovering why our skin changes during this time and how fluctuating hormones, lifestyle, and the environment around us can all have an impact. My guest today is women's health specialist GP Dr Nighat Arif, who will be explaining the medical treatments, skincare regimes, and lifestyle tweaks we can all consider, and who, where, and when to go for help if things don't improve. Dr Nighat has over 15 years of experience in the NHS and private practice as a GP and medical educator, specialising in women's health. You'll also know her as a TV doctor from BBC Breakfast, ITV's This Morning, and BBC Look East, and she also hosts her own Sunday breakfast show on BBC Three Counties Radio. She is passionate about menopause care and appeared in the Channel 4 documentary by Davina McCall, as well as on numerous podcasts, and has been recognised for her exceptional commitment to raising awareness on menopause and women's healthcare in Black and Asian communities. So welcome, Dr. Arif. Thank you so much for joining us.
Thank you so much for having me. It's so lovely, Katie, to actually make time to do this. We've been trying for a long time, haven't we?
I know, absolutely. So many women in our Facebook group come to us with so many different skincare concerns, and they're often looking for advice and solutions, help them with everything from allergies and acne and rosacea to sun damaged, sensitive, dry, itchy, sort of dull and tired looking complexions. And they're often confused as to why this is happening in sort of midlife. So I just wondered if maybe we could chat first about what's actually going on with our skin and why so many of us notice these changes as we go through perimenopause and menopause.
So firstly, I think we need to step back very quickly from perimenopause, because our skin goes through so many different changes anyway. If we think back to puberty, when you get your skin pores change a little bit, your hormones are changing, because your estrogen, progesterone, and your androgen hormones are fluctuating to kickstart your puberty years, then that sort of happens exactly the same when it comes to perimenopause. So perimenopause is when you are having periods and menopausal symptoms. We know that starts around the age of about 40. And yes, you can still have periods and still be menopausal. And that's when we see another fluctuation in hormones, particularly estrogen levels that fall. Well, androgen levels can stay constant and lead to sort of a whole variety of unwelcome changes, ranging from, as you were saying earlier, acne, which can feel reminiscent of your teenage years, to wrinkles that might start to appear overnight, which you hadn't thought about. And then obviously as your progesterone changes, that also can affect your skin and hair quality. So we do see that it's quite a common sign. And for some of my patients, it might actually be the first sign that they see, which is related to the perimenopause, but might not put it down to the perimenopause. They might put it down to, oh, do you know what? It's stress. My life changes have happened because my career's taking off. My kids are going, flying the nest. As women, we always put down our symptoms to other social factors which are going on, rather than thinking, hang on, actually perimenopause is when our body does another hormonal shift, just as we did around our puberty years.
And are different women affected in different ways? I mean, things like sort of genetics, do they come into play? Obviously, I know you talk a lot and support women in the Black and Asian communities in particular. Have you noticed with your patients that there is a difference?
Oh, do you know what? This is a really good question. And I'd like to say I wish I had more data. The basic factor is we don't have a lot of data when it comes to Black and Asian women anyway. The only study that we have is the SWAN study, which is Study of Women's Health Across Nations, which is a US study, and started to look at how menopause and menopausal changes affect women from different ethnicities. And they found that Black women, Latina women and South Asian women actually started perimenopause 2 years earlier. So we don't have a definite age range. I mean, 40 is what we're saying now globally because there's more awareness. But we do find that actually 38, 39 is when Black and Asian women will start going through the changes. So if you think about that, then we know that actually that will affect how your skin responds. So you'll get dry skin, flaky skin. And because the androgen hormones change, remember, if you've got a background history of, say, polycystic ovarian syndrome, which is higher in Black and Asian communities as well. Also, if you've got a history of fibroids as well, fibroids can feed off estrogen. And if that is slightly higher in your background as well, that will also affect the way that the hormones interact with your skin. So that straggly hair that might appear on your chin, which you never had before, well, we see that more in Black and Asian ladies. And the difficulty we have is that there's a lot of shame and stigma attached to the skin changes in these communities anyway. They don't see it as something that's really important to talk about. So if the skin becomes thinner during perimenopause, there is flaking of the skin, or maybe breaking of the skin that you hadn't noticed before, breaking of the hair. We don't offer that forward from these communities as a sign of anything to worry about. We are finding that that's changing a lot more, but we need more studies in Black and Asian communities to answer some of the questions that you've asked me. Is it genetics? Is it lifestyle? Is it the fact that it's your environment that you're going on? I just don't have the answers for that at the moment.
Yeah, it's so interesting, isn't it? And I think a lot of us are looking at our lifestyle the more we start noticing. So, you know, I mean, while we're on that subject, are there any, whether it's skincare regimes or lifestyle tweaks that, you know, we can all easily incorporate, you know, into our daily lives and routines?
Yeah, I always say that if you're going to start doing skin regime, actually start it before you hit that period in life. I mean, we should be looking after our skin content. It's sort of, you know, toner, cleanser, moisturizer, adding that moisture back into your skin as much as possible. We do know that as the skin changes, maybe you need to add more moisturizer, so something with hyaluronic acid or lots of glycerin in order to build back. I would say the building blocks of your skin. We know that collagen needs support as well. So it's not just what you're putting on your skin, it's your diet as well. So cutting out saturated fats, hydrating well. Exercise is really important because that just allows so many different functions and metabolisms to happen in your skin. But also at this stage in life, I would say to my patients is we need to be ruling out other conditions. So we know thyroid is twice more likely common in women when they go through perimenopausal changes. So have a check, make sure that you're not becoming underactive or overactive. We know anemia, especially when you have perimenopause, your periods might be really heavier or more frequent or irregular. So if you're becoming anemic because you're bleeding more, and again, in Black and Asian communities, there's a higher chance of fibroids forming, and therefore you bleed a lot more, it's important because that will impact on the quality of your skin.
It's interesting you say that, because actually when I was going through the perimenopause, I had very heavy bleeding, became severely anemic, and noticed that these changes, I never had issues with my skin before up until then. And it's funny, now that you say it, I look back and think that that actually makes a lot of sense.
You made a really good point earlier, and you said to me, what are the medical treatments available? Because as a GP, as an NHS GP, the patients will come to me first and say, I'm approaching it, my skin has changed, I've got acne or rosacea. So rosacea is where you get blood vessels that go up into the skin, they become very visible, and that will become more prominent if you're having a hot flush. And in some women, you can end up getting small pustules with your acne rosacea as well. So for that, I find that it depends, it's very much individual what treatment I give or offer my patient. Hormone replacement therapy, now I know it's not for everybody, but we do know that actually because of decreasing estrogen, that's going to impact on your skin's ability to regenerate and be able to get newer skin cells in. So hormone replacement therapy can work quite well. For some women who get acne, I often sometimes on a very low dose with lots of counselling put them on spironolactone, which is a fabulous androgen blocker. Spironolactone is also a water tablet as well. And you can use this very safely at very low doses during perimenopause. I also say to patients, think about other things that you can do. So have a diet, which is really important, high amounts of flaxseed oil, because that's a great anti-inflammatory and helps with anti-inflammatory conditions, because acne is an anti-inflammatory condition as well. And then the cleansers that you're using. The other thing that I have found, and the research is really good around this, is salicylic acid cleansers. They're really good because they sort of help stop breakouts, and they just treat the skin, and they sometimes are allowed to, they help treat these cysts that form around acne as well. So there's a whole variety of medical things that we can offer on the NHS to patients.
Yeah, absolutely. And another thing that people are asking a lot, and I'm very keen when they come to our Facebook group in particular, that we ensure that they're not sort of going off after very expensive, trying various different things that may or may not work or have no evidence behind them. Now, one or two of the things that they often ask are, do these collagen drinks and supplements work? And what are your thoughts on things like collagen drinks and supplements, and how to know? It's a whole minefield, isn't there, of sort of potions and lotions that may or may not help.
Oh my God, Katie, I'm so glad that you said it's a whole minefield, because I'm also finding it is such a minefield, because was it Diane, our lovely friend Diane Danzebrink, who said the menopause is now the new black. Everybody wants to get onto the bandwagon of these potions and lotions and drinks, and do this, and lie on your head and you'll be better. I fib. But if I come back to collagen drinks, I'm still learning as a clinician myself. Now, I know that looking at the studies back in 2019, there was a really good independent study that showed that in laboratory-based studies, there is a potential for collagen peptides in drinks and supplements to improve the skin hydration and reduce wrinkles and strengthen our own collagen network. So those were laboratory-based studies that were done, and dermatologists and skin brands and collagen drink companies obviously saw this and thought, oh my God, this is amazing. If we can get a collagen supplement to show promise that it improves skin elasticity and dermal collagen density, then isn't that great? But if you drill down into the studies, and I looked at these, is that they vary so much from anything between 2.5 to about 10 grams per day of collagen. And so what actual amount you're getting into a drink is really difficult. Now, when you put that into the real world and take this out of laboratory studies into the real world as a supplement, I have to say the data is really scanty. I'm finding it really hard to find a good data in the real life that shows that collagen works, because the digestive process breaks down collagen in the guts, and so it doesn't actually go from the digestive system into the skin at the volumes that you need in order to allow you to have the reduction of wrinkles that we hope that you will be able to get, and also to plump up your skin. So I have to say, for me at the moment, I'm not a huge fan of collagen drinks. I think that they don't offer a lot of benefits. You're probably just going to wee it and poo it out more than anything. And it's more about how can you be better with your diet, as you were saying earlier, cut out alcohol, decrease smoking, look at your stress. Those are the factors which are going to have longer term benefits.
Yeah, absolutely. Well, look, I mean, this has obviously been a really helpful chat, and we could talk for a lot longer. Now, there's a couple of more, sort of couple of extra things I'd love to cover. We haven't covered things like changes to the internal skin, so the vulva, the vagina atrophy. That is really common during midlife and menopause, and we have sort of covered that in series 1 of the podcast. But for those that haven't listened to series 1, I do think it's important that we just very quickly touch on that area, if that's okay with you. So for women who are coming to you and they're having very, perhaps dryness, itchy, sore, uncomfortable sex, what would you recommend?
So I'm actually, okay, I can report back on this on qualitative studies and things, but we're getting more Black and Asian women talking about vaginal atrophy, which we never used to have before. And I think it's because there's much more awareness and the taboo, because like I say, for some of my patients through social media posts, they're coming back to and saying to me, that was one of my first symptoms that I was getting, vaginal atrophy. So vaginal atrophy, we already know that when estrogen decreases, the skin cells become around the vulva and the vagina becomes thinner, and they can easily split. So you can get soreness, itching, difficulty having sex, difficulty having smears, and sometimes an overproduction. So it's not the sensation of being dryness, but an overproduction of fluids. Now, there's non-hormonal treatments. So I would always recommend. I've now come to the conclusion, and I've said this to you before, is that just like we look after our face, we should be looking after that bit of skin between our legs. And we never really actually do. But it's so vital, because we're going to need our vulva and vagina for the rest of our life. So using a vaginal moisturizer is really good. If you're prone to getting things like thrush, then I would make sure that you don't use anything that's got glycerin in it. So I don't do a lot of brand promotion, but I can't really talk about moisturizers without mentioning a couple of brands. So Yes and Sutil Luxe or Sutil Rich don't have glycerin in them. So if you're prone to getting thrush, then I would recommend getting that. There's a difference between a moisturizer and a lubricant. So a lot of women say to me, but I got Yes, but there's a lubricant. Now, lubricant are oil-based and they sit on the skin. A moisturizer gets actually absorbed into the skin. So that's the difference. And what I say to women is that if you're having difficulty having sex, you need to use both. So if you use a vaginal moisturizer, water-based in your vulva and your vagina, and then you use a water-based lubricant such as Yes or Sutil, then on your partner, oil and water don't mix, they slide. So that's sort of a double slide method to allow you to have sex comfortably, because it's not normal to have painful sex. And then on top of that, if that's not giving you the relief that you need, topical vaginal estrogen is very, very safe. We sort of clump all HRT and estrogen into one block, but we know that's not the case. So topical vaginal estrogen, such as Vagifem, Vagirux, or Avestin creams, there's a whole different types. There's about 8 different types on the market that your NHS GP can prescribe for you. You can now get Gina, which is a pessary over the counter. So we know that if you put the estrogen back into the cells, they replenish and therefore reduce or prevent even getting vaginal atrophy in the future. So one of my tips is that even if you've had breast cancer or you have breast cancer, a lot of breast cancer oncologists and specialists are now making a lot of noise around this globally. I mean, I follow a lot of doctors in America as well. And the studies are very reassuring that it doesn't cause a reoccurrence of your breast cancer. The majority of women I know can very safely have topical vaginal estrogen, and you must look after that bit of skin sooner rather than later. Don't wait for it to get really, really bad or really sore. I sort of think back to a patient I had recently who said, I thought I'd have to wait until it got really problematic before I came to you. And I was like, no, that's really not the case. You should be here straight away so we can start earlier to prevent something worse from happening later down the line.
Yeah, it's so shocking. I mean, I've heard from women whose mothers are in care homes, and they're so embarrassed to talk about it, and they can't understand why they're getting recurrent UTIs and all sorts of bladder infections. And it's interesting. It's actually the most read article on our website, and it's one that I actually did with you. And it's about vaginal atrophy, because I guess it's probably the most embarrassing and taboo area. And so people will sort of Google it quietly rather than discussing it. So it's great we're having these conversations to normalize it and to make women realize it's you're not alone. It's not just you. It's a very common and easy to address condition.
The shocking thing is that 75 to 80% of women will go through this. So even if you're not getting the symptoms in your perimenopausal phase, so you're having periods and you're getting hot flushes or whatever, you might not have symptoms in your menopause, which is 1 year without a period, but you'll obviously somewhere down the line in your postmenopausal years, because we've been so, even doctors, I have to say, I hold my hand up, we used to teach women that this is a phase that you go through and then that's it. But we know it's not. You will be postmenopausal for the rest of your life. And therefore, vaginal atrophy will catch up with you very, very slowly. And it gets misdiagnosed as thrush or recurrent urinary tract infection. And even the most sad thing is if you look at historically consultation notes, we know it happens to about 80% of women at some point, but only 10% of consultation notes will actually have documentation of vaginal atrophy, which shows that either doctors aren't picking it up, which I have to say, again, I put my hand up as a clinician and say that's probably the case because of a lack of awareness of that, or patients aren't offering it. And that has to change because it's very, very simply, easily remedied, but it saves the NHS so much money. If you can imagine, a woman doesn't go into hospital because she gets recurrent urinary tract infection, she doesn't get sepsis. And a bit of vaginal estrogen will actually save her life, but save the NHS so much money as well, which is, I think, just a no-brainer. And this is why what you're doing is incredible by raising the awareness.
Yeah, absolutely. And I think, you've said it, and I've sort of learned it over the years, that actually a year's supply of vaginal estrogen is the equivalent of a day's systemic
Yeah.
HRT. So it's important for women to realize that it's not, absorbed into the bloodstream. So, look, have you got any last sort of words of advice, top tips, if women are worried about their skin in general, inside or outside? Where should they go? Where should they go first? To a GP, to a dermatologist? Obviously, have a look at various resources as well. What would your advice be?
So I always try and say to people that it is all available on the NHS. It's just knowing about it. So firstly, ask for a menopause or a women's health specialist in your GP practice. So I talk about skin and vaginal atrophy a lot with my patients. Number two is you have to become your own advocate. Research, and there's so much free out there. So the Latte Lounge, you do so much as well. I do so much on my social media, which is free evidence-based information from the NHS. And also look at the multiple resources. Please don't be reliant on one. Last sort of advice is, if it's too good to be true, do you know what? That's probably the case. Please do not spend thousands and thousands of pounds on potions and lotions because there's no evidence behind them at all. And what you're doing already, which is helping your skin, is probably what's working. And it's having that conversation with the GP and book a routine appointment. It's not an urgent at all time to discuss it, to have that conversation. If you do have the means and the capacity to go to a skin specialist, please do your research though, because there's a lot out there who actually don't know about menopause. There might be dermatologists, but they might not know about menopause and hormone replacement therapy and how that interacts with other things. So that's where you're going to have to be really doing your research carefully.
Thank you, Dr. Arif. That's really fantastic advice. So lastly, where can people find out a bit more about you and your clinic on socials and website?
Well, thank you so much for having me. I'm very easily found. I don't know whether I am, but I'm just saying that. I'm across TikTok, so I make lots of videos on TikTok at the Dr Nighat Arif. I'm on Twitter, Instagram as well. And as of next Friday, the 11th of November, I'm launching Dr Nighat's private women's health clinic with OSD Healthcare, and there are details on my Instagram of how you can book if you wanted to see me privately.
Well, we'll put all those in our show notes so that everyone knows where to find you. But again, thank you so much. This has been really, really helpful, and I hope everyone find it helpful too. Thanks for listening to the Latte Lounge podcast. Please subscribe wherever you're listening so you don't miss our next episode. For more support with all things menopause and midlife, head to our website lattelounge.co.uk and search for the Latte Lounge group on Facebook. This podcast was sponsored by Clarence and produced by Emily Crosby Media.